Okay, I think we're live. So good afternoon, everybody. I'd like to call this meeting to order. This is the Thursday, November 19th, 2020, 3 p.m. Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link may be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you now have audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot verbally be asked, use the question and answer function. All questions should be directed through the chair. And for roll call purposes and attendees, just call your name out as I see you. Jim Cooper.
Here.
Meredith Lepre.
Here.
Melissa Murphy.
Here.
Malcolm McNabb.
Here.
We also have Libby Gibson, Town Manager.
Here.
Roberto, Health Director.
Here.
And the other people that are attending, we'll just have them for the record state their name when they need to speak. So is there anything on the public comment that you see that's not on the agenda that people would have anything to bring up?
There's only one person in attendance and I don't see a hand up, so I think we're good.
I actually have a public comment that someone asked me to present. Can I do that?
Yeah, sure. Yeah.
It's from.
So it's a question about why we can't get attestations from the people as they're coming off of the boat. It seems like a lot of other places do that. When I go to work every morning, I have to do that. So it seems like it would behoove us with the number of people coming over to work for the day to be able to, sorry, this message is from Megan Perry, that we should be able to ask people to do attestations when they get off of the boat before they head off into the island. And it's unclear. I know I spoke to Roberto about this, but there are a lot of other places that are doing this. And I don't know why as a town, we can't do this. And I agree with her. I think we should be able to do this.
Libby?
I don't know any other places where people are coming off a boat to get to a town like this exact situation. This doesn't happen on the Vineyard. And I don't know of any other place in Massachusetts where this is happening. This has come up. You're absolutely right. I thought I had forwarded around a while ago an email from town council about this, and we've talked with town council several times about this. A lot early on in COVID, this came up, and basically the answer is that one of the primary obstacles, this isn't necessarily a legal issue, but one of the primary obstacles is going to be a lack of resources to administer a program at the boats. And where is it administered? Is it administered in Hyannis? Is it administered in Nantucket? Who does it? The town or the boat lines? I don't think they're going to want to do that. And there's an overall legal question about whether or not it's legal. It's completely different for people going into a workplace than it is for people coming onto the island.
I guess the question is not like, we're not saying you can't come here, but asking people if they are having symptoms, because then if somebody then tests positive off island, and it would be make contact tracing. So I just think it's something that we should see if that's something the town can have somebody down there, when they get off the ferry, they have to fill it out.
I mean, if the Board of Health as a whole wants to have town administration and or the health department look into that, as to what it would take logistically, and it would be voluntary because I don't think you can force people to undergo the screening. It would take a lot of people to do that. So we'd have to be prepared to hire them and supervise them and oversee them. And at every boat, there are a dozen boats a day right now between the Highline and the steamship. So we are happy to provide the board with what it would take. And I am willing to bet those resources are not readily available.
Melissa, you have your hand up? Meredith, anything?
I mean, I don't know how everyone else feels. I think it is worthwhile to look into that just because I think that we're basically like a big cruise ship. And if that's something that we can control who's coming and go, not control who's coming and going, but have an idea if people are symptomatic, it might be helpful in our current situation.
Melissa?
Yeah, Steve, I think that this was brought during public comment, and if it's something that we should put on the agenda for the next meeting, then I think we should do that and have a discussion about it, but I don't think it's appropriate to have a discussion under public comment.
Yeah.
Yeah, we could, if you really, we can make an agenda for our next meeting, talk about it some more.
In the meantime, we can definitely do some sort of a logistics explanation on how this can be done.
Right.
Otherwise, I don't see any more public comment.
Okay, we'll move on to the next agenda item, which is Act Now, the short-term rental presentation.
So I'll let Julia take over, and I think you can share your screen.
Great, thank you.
Could you just say who you are, Julie,
Yes.
for the record?
Of course, Julia Lindner. I'm the executive director of Act Now. I will give a brief overview of Act Now because this is our first presentation to the Board of Health. But before I start, I think like many people who come before you, just want to say thank you for all of the hard work that you've put in these last few months, to Roberto and his team as well. So it doesn't go unnoticed, and thank you. Like I said, I'm just going to give you a quick intro to Act Now before going into the discussion that I think is really meant for the Board of Health and for the town at large. And that's our proposed bylaw that we just submitted last Friday. So for those of you who may not know us very well or may know us from our early days, our mission is really to try to protect what the community loves about Nantucket. And that seems like a very broad umbrella. And lately I've been thinking about it almost as trying to protect the community itself, which is really what makes this place so special. The organization was launched about a year ago by Peter McCausland, who is a longtime summer resident and someone who cares very deeply about the island. We have a very small board that includes Peter and 3 year-round residents, Bill Little, Tobias Glidden, who's our chair, and Linda Holland. And we're committed to sort of making sure that as we grow the board, that it's really a majority of year-round residents. And really our focus is on some of the critical issues that are a result of the massive growth that this very popular island has seen in the last 30 years. I think organizations like ours have come up over the decades. We're not the first one to be around to try to protect this place. And I think there's a lot of great efforts going into that area. And we just want to add and help. So for us, this includes identifying ways that we can manage a more stable development and growth of the island and the economy, and sort of the impacts on the community, the environment, the infrastructure. And we hope to show to the community that we can use research and partnerships and make some real progress with respect to the housing crisis, for example. Whenever possible, we're definitely looking to collaborate with existing organizations and experts to sort of expedite solutions and hopefully make them more effective. So one of our first areas of research has been short-term rentals. And part of the reason is that we had a belief from reading about other communities that it was having an impact on housing, on development, possibly on transportation and the infrastructure, for example. So really touched upon a lot of the areas that we were looking at. And what has been interesting in this area is that in the past, it may have been more of a black box, but we have gotten some really good, I guess a limited amount of information, but some good information to start looking at insights from a perspective that the state has been requiring short-term rentals to register for the short-term rental tax. So what we've done is we've been studying the registry, and we've been researching other communities, researching the law, and I'll share with you some of the insights that sort of led us to the proposed bylaw that we've presented to the town. So I think what's really important to acknowledge is that the vacation rental market was a very sort of balanced market for a long time, done by year-round summer residents. But the last 10 years have really brought some massive changes. And that really is led by Airbnb, sort of continued low interest rates, and a new breed, if you want, of investors, which is sort of this Airbnb investor. You can call it Airbnb arbitrage. There's a whole slew of terms out there for this category. And it's not a black and white thing, but it is full of nuances, and we're trying to keep those in mind as we go along. So today, like I said, we have a little more information about what is going on the island, and we know that we have about 2,000 registered short-term rentals that are registered with the state. And we've gone literally one by one to analyze who was the owner behind, and we found that in the large majority of the cases, they're owned by off-island people or businesses. What we also know from the registry is that there's a large number, so over 330 short-term rentals that are actually held by owners who have at least 2 on Nantucket that are not owner occupied. Okay, this is kind of a hard concept to understand because, first of all, why does the state actually track this? And it's got to do with the fact that the state gives us an option to elect for an additional tax on top of the short-term rental tax. It's called the community impact fee. And what they're saying is maybe those properties are having a bigger impact on housing and on infrastructure. And so we're going to keep track of them. So that's what, effectively, this is what the registry tells us. This is the extent of what it tells us. What we know by looking at ownership is we see that there's a growing number of investors that are choosing Nantucket as the place to operate a short-term rental business. And so some of the bigger examples or that have a name to them, if you like, are real estate developers like the Copley Group, or destination clubs like Inspirato and Exclusive Resorts. These may not actually own the properties. These sort of vacation clubs, if you want, typically they have a long-term lease with the owner. So it might be a 7 or 10-year lease just for the summer, for example. And then they turn around and they sublease, let's say on a weekly basis, for example. But we also have a much, I'd say, bigger subset of smaller groups that may only have 1 or 2 properties, and maybe they have a bigger footprint somewhere else, like in Florida, for example. So what, in itself, I don't think that that would necessarily be a huge concern. The concern, I think, comes from the fact that when you look at the rentals and you realize that these investors buying into the housing market are really having an impact on the type of property that we're developing, what we're putting on a property. They're having an impact on access and pricing of year-round housing. And they are really having an impact on the neighborhoods. And this is something that I've learned a lot more about more recently. So I think some people might say, you know, a lot of these rentals are higher end and they're not in year-round neighborhoods. And I think that's partly true. But when you start looking at the list of rentals, you realize, okay, hold on a second. There's a good subset in here that's in traditionally year-round neighborhoods that are being held by people who don't live on the island. So they're obviously not just renting their own home. And you find examples of homes that were year-round that were definitely converted into something that basically is never going to be lived in again. And so the picture I have here is one of those examples. This one's on Cato Lane. But the neighborhoods that we see as being sort of bigger targets or more affected right now are definitely the Myacomet, Mid-Island, and near the airport, Monahans, Lovers Lane. You know, there's sort of some of those lots may be more affordable, and that's where I think investors are finding value. And oftentimes, even if there's a little space, there's room for a pool. That's obviously really attractive for them. So, you know, ultimately, some of these are really businesses operating in residential areas. And when we speak to people, you can tell that this sort of intensive use has had a real impact on living nearby. And I think that's something that more and more people are aware of. But the real reason why, you know, we talk about, so they're going into year-round neighborhoods and what's the impact there, it's ultimately year-round residents are really having to compete with investors when buying a home. And that means that if we thought we had a housing access and affordability problem, you know, just from being an island, now we have an additional issue, which is there's this enormous pressure coming from outside saying, hold on a second, I'm willing to pay a lot more than you are, a year-round resident, because I can actually make money on this property in a way that maybe you can't because you need to live in it, at least part of it. So, you know, this is ultimately not something that has been going on just on Nantucket. It's a phenomenon that's been happening everywhere across the world. And you can go look at Airbnb launched, filed the prospectus for its IPO this week. So they're actually moving ahead with their initial public offering despite the pandemic. And one, I think Nantucket can understand why, because we see this summer was actually pretty popular. But the first ones that really saw the impact of the Airbnb and short-term rental market were the cities. You know, the resort communities, I think, had always known about this, but the cities were the ones who saw that apartments were being bought out and people who should have been living there were now being squeezed out and rents were going up. So places like LA County, San Francisco, New Orleans, NYC, and more recently Boston have all put in, you know, pretty strict rules. And in general, they've banned investor-owned. So all they're allowing is, like, if you own an apartment, you live in it, you want to maybe rent out a private room or an accessory unit, you can do that. But otherwise, you can't. It's not legal. So obviously, that's not a situation for Nantucket. That doesn't work for us. But in Massachusetts, like you guys know, in 2019, we, through Governor Baker, you know, we saw the expansion of the lodging tax to short-term rentals. And Baker administration also presented legislation that would give municipalities the option to legalize and regulate short-term rentals in a way that would work for communities and customizable, which is the best part. And so the way that we've seen most of the bylaws go is trying to lessen the impacts on housing and trying to lessen the impacts on neighborhoods. And that's sort of the approach that we've been taking. So our proposed bylaw is hopefully going to be considered by voters at the next town meeting. And the goal of the bylaw is to foster the traditional weekly vacation rentals that we've had by homeowners while trying to protect year-round housing and give some protections to the neighborhoods that are living nearby. So the way we approached it is two sets of rules, if you like, depending on whether the unit is a primary residence or not. So the first question is, you know, is this really a short-term rental, right? Are you offering this up for stays of less than 30 days? And if the answer is no, I'm doing longer rentals, then this doesn't apply to you, monthly rentals or seasonal rentals, obviously. If the answer is yes, I do shorter term rentals, 29 days and less, then the question is, does a Nantucket resident live there? And if the answer is yes, then what we're proposing is you get to short-term rent cumulatively up to 12 weeks in a year. And if the answer is no, this is not the residence of a Nantucket person, then you get up to over 6 weeks, which is 45 days, again, cumulatively. So if you decide I want to stay there for the month of August, but I want to do weekly rentals in July, and maybe I want to do 2 weekly rentals in September, that kind of scenario. And we're also proposing a 1 week minimum across the board. The large majority, we believe, of rentals are 1 week. And we think that this is, to some degree, one of the impacts of Airbnb has been to really bring down the number of days in a stay. And so trying to push out the shorter stays to the B&Bs, the inns, the hotels, and trying to sort of lessen the turnover in the neighborhoods is something that we're hearing from neighbors as a concern. We have, there are a few more smaller components to this, but one of, I think, the things that you might be interested to hear about is we're also proposing an occupancy limit, which is really saying 2 people per bedroom or whatever your Title V restraint might be or constraint might be. And so, but I think that the important part to understand about this bylaw is that it effectively legalizes short-term rentals as an accessory use to primary residential use. And so that's the sort of the nuts and bolts of our proposal. We have looked at many iterations, and we believe that with your support and Roberto's support, and likely the help of a short-term rental monitoring compliance software, which I think there are more out there and they're beginning to be very mainstream, and the cities and towns who are working with them are happier, I think, than those that are not. I think that can make for very effective enforcement over time. And so the ultimate goal is to try to draw a line in the sand and say, okay, so we're not attracting more investors to Nantucket who don't want to spend some time here. We want to attract people who want to spend time here, who want to know their neighbors. And ultimately, we want to try to protect these year-round neighborhoods that are really, the answer to some sort of affordability and accessibility for those who don't qualify for affordable housing. And so that's sort of the end of my spiel, and I am happy to take any questions that you might have.
Questions for Julie? Wow, nobody? Malcolm?
Yeah, I just have a question. How go back to enforcement? Is it a Board of Health enforcement? And that will take time and resources and people.
Yes, so it's something that I've discussed with Roberto. In Massachusetts, it definitely is a Board of Health. Generally, it's set up that way. So we, I think the guidance of our council, opted to go towards Board of Health. I think Roberto acknowledged that we are not requiring inspections as part of the permitting process and the licensing program. So I think that is a huge part of the burden. There could be a big burden if, for example, a program would require inspections, right? But in this case, it is, we're asking operators to attest that they are following the rules unless there's a required inspection for an emergency, purposes, for example. I think the reality is that right now, And maybe Roberto can correct me, but the town, in particular, the health department, has been dedicating resources to this area for a number of years without really seeing any funding coming in to help offset those resources. So, you know, this program establishes a way that acknowledges that there are resources that are being dedicated and that there should be a funding source attached to that, and that there should be a better outlet than calling the Board of Health directly or calling the police directly for complaints coming in from renters or from neighborhoods. And hopefully by adopting a
Yeah, well,
bylaw.
certainly, you know, overcrowd. I'm sorry.
No, please.
You're skipping a little bit. I don't know if it's yours, but certainly, you know, lack of housing, lack of affordable housing. We see lots of overcrowding. Often we have to condemn a house, unfortunately, and then the question is where these people go after we throw them all out. So there's certainly, to me, it's a health issue. It's an economic issue, but it's certainly a health issue. It's certainly justifiable as a health issue. I would just say if this gets passed, that Roberto gets some funding or people. I mean, we keep putting more and more things on Roberto, and you know, his limited staff. That would have to be part of the warrant.
So the way, and maybe Roberto wants to, I don't want to put words in your mouth, Roberto.
So as of right now, we answer all the complaints that happen of housing complaints that come in, regardless of whether they're Airbnb or not. A significant portion of our inspections are usually towards the end of an Airbnb. Somebody has already stayed on Nantucket for the week, and on the last day we get a complaint saying that the house is filthy or whatever, but mainly because they want their money back is what it comes down to. But when we do get there, yeah, sometimes the houses are absolutely filthy. They're, you know, broken windows, doors that don't latch, no hot water, things like that. And when we do run into those, we do issue enforcement orders, and we do issue that. But as Julia said, we actually don't get any of the funding from that, because when we issue tickets, it goes into the general fund.
So the way that we're suggesting this for now, the program or the fees collected from the permits would go into the general fund. I have to admit that we did consider offering a second article that would be a revolver. I think that not to tie the town's hands is probably a better approach, and perhaps after a full year to come back to town meeting with an article for a revolver may not be a bad idea. That's something that we discussed. Roberto mentioned that he was asking for a full-time inspector and for FY 2022. And given that this program would take some time to ramp up, I think that might work for year one, and it would clearly be budgeted for any further years beyond that and be self-sustaining.
Jim?
Is the 45-day rental period for off-island people, is it specifically put in there to discourage people? In other words, that they couldn't make the profit they needed to make in only 45 days? So is it put there to discourage people from doing this?
So the idea is, the question was, how do we sort of disincentivize like the person or company that says, I've got money to operate a short-term rental business, where am I going to do it? And I'll pick Nantucket, right? And I won't necessarily have any skin in the game. I won't be necessarily invested in the community. I just want a short-term rental business. So how do we disincentivize that? And the answer was difficult, because you really can't regulate the ownership of a property, but you can regulate the way it's used. And so by limiting the number of days, yes, you do. What you do is effectively disincentivize a certain type of use, if you like. It is by no way saying that we don't want rentals on the island, because this has been a long time tradition. And we've, we think we've gone through a lot of the scenarios. It's by no means perfect, okay? And we're just coming out with this, but we think that it's a scenario that accommodates, let's say, a family that inherited a home that spends a few weeks there that also wants to rent to offset some of the costs and the taxes and whatnot, and those types of scenarios, if you like.
Any other questions for Julie? Melissa?
Thanks so much, Steve. Thank you, Julia. I don't necessarily have questions, but I do have a couple of comments of places where I see some concern in this. One, I know that you've mentioned the Copley Group. I'm really curious about what the number of properties are that are owned by these corporate entities or long-term leases. I feel proportionately that this is trying to solve maybe a problem that is really a very small segment of our community. So I'd be curious to see that. Also with the caveat that just because a home is purchased by an LLC doesn't mean that it's owned by a business. There are plenty of families and trusts who put their properties in LLCs. So I'm curious about that. I'm also concerned, and this may be outdated, but there are a number of people who make investments in their properties on Nantucket and rely on rental income seasonally. They use them periodically and they become their retirement homes. And I know that that's been the case for several people that I've known over my, 3 or 4 decades of being here. So I'm really concerned about locking out people's ability to invest in their future and spending time here and leaving a legacy for their family if that's what they want to do. And I think, I've had the privilege of speaking with Julia a little bit about this previously, and in my previous role in the Culture and Tourism Office before the short-term rental tax became a reality, Roberto and I actually spent some time as colleagues thinking about this sort of registration process and how that could benefit. And do you remember that? We did all those software tutorials together.
We did.
Yeah. So, how could there be a system that would help the town see some registered, how could we register the property? So that part of the process, I actually very much support. I think it's really important that the town has a finger on the pulse of what's being rented from that sort of public safety and public health perspective. But I'm really concerned about the limitations. I'm concerned about residents versus non-residents and sort of the tone that sets. But I'd like to sit with this a little bit longer and give you my feedback, Julia, because I'm feeling like as it's presented right now, I'm not sure I could support it, but I understand the why behind it. So those are
if I can, Melissa, I'm sorry, through the chair, I'm sorry.
Go ahead.
Thank you. So I think that, first of all, I think your concerns are absolutely legitimate. I feel like I've spent so many months looking, and we've spent so many months looking at this issue that it's a steep learning curve for most people to get up. And so here's what I would, and I'm happy to answer your questions in more detail, but here's what I would say. We absolutely agree that LLCs and trusts don't mean that people are investors. I completely understand that. What we haven't what is not 100% clear is, identifying, oh, this person does not use their property, right? This person only uses their property 1 week every year. But what the general trend of what we're seeing these properties, the reason they're being bought and what they're turning into, right? So how they're developing gives you an indication of what use they're going to have. And I think the fact that, for example, if you look at listings, most properties listed on the market right now are either saying they have a pool or they could have a pool. That's an indication that who they're targeting and who's willing to pay top dollar is an investor to some degree. And your best bet might be a short-term rental investment. So that's more of a coming from the real estate side. It's not a great trend to see that we're not marketing to families and folks who may want to spend more time here is I guess what might be a little concerning there. We are lucky that we don't have major ownership the way that cities have. So in New York City, for example, right, they've realized that these big corporations had snatched up like a ton of apartment buildings and were Airbnb-ing these. That is not the case, like you said. So the Copleys, Copley has, close around 15 properties. Inspirato and Exclusive Resorts together have about 15 properties. These are not huge numbers. What we have more of are these sort of smaller, we have 1 or 2, maybe 3. We're a property management company out of Boston or out of Florida or out of California, and we have 1 or 2 properties. We're a smaller operation. We have a couple rentals on the Cape, and we have one on Nantucket. They're still businesses ultimately, but they don't pop up as, oh my gosh, I'm a corporation, and they're not as obvious, if you like. But I think that trend is certainly just as concerning. And I agree with you that we're not trying to tell someone who, maybe bought their property, who wants to retire here ultimately, that they can't and shouldn't rent their home in order to be able to afford Nantucket. The reality is the window for most people, I would say the traditional vacation rental is not, and you actually would know more about this than I do, but it's not 14 weeks, right? It's, if you're able to rent 6 weeks, 8 is kind of a stretch sometimes, right? The last week of August or maybe the first week of July, there's some, so 6.5 we felt was a pretty strong number given what a regular homeowner can really expect to achieve. And in reality, they're going to go for the high rate weeks that they usually go for. And so they will make up the bulk of what they would have made if they maybe had access to 8 weeks, which is what they are, or maybe they, what they would have aspired to on a regular year. Does that make jive with what you know or what you understand?
If I can, I think that that's a broad brush. And I think that there are a nice amount of off-season rental opportunities. It depends on the location and all those things. And it depends on what kind of year we're having. And, the thing that I really just don't like is limiting, I'm wrestling with limiting that for people. I may be more comfortable with 8 weeks and for somebody who has a second home here, because that takes into account, or 10 weeks because it takes into account the ability to get some shoulder season rentals. But I'm going to be really curious to hear what kind of feedback you get as this sort of goes out. And I think the non-voting taxpayers and some of those other groups, having them take a look at it, because this is the demographic of constituents who this will most impact. And I'll be looking forward to hearing feedback from our second homeowners about how this might be impacting them.
Okay, thanks. Any other questions for Julia, or we all good? Well, Julia, I'd like to thank you for coming on and giving us that presentation. And I'm sure Melissa will be back in touch with you. Probably has a lot of questions for you. So thanks for coming by.
Thank you. And well, thank you so much. And as you digest this, you know, I know it's a lot, so feel free to reach back out. Thank you very much. I appreciate it.
Thanks.
Thank you.
Okay, next on the list, PFAS discussion. So before we get started on this, I would just, one of the reasons why this is on the agenda was due to some information that we came across last week. And I'd just like to state for the record that this information that was in an email in no way was the Board of Health or the town trying to, for transparency reasons, suppress this information, and under no circumstances was it under the town's directive with this information that was in there. So I'd just like to leave it at that, and I'll turn it over to Roberta.
Yes, so I did forward you the memo from the town that we just have from CDM Smith and Chuck, our PFAS consultant. So what we're looking to do is wait for the CDM Smith full report. We're expecting for that to come in early next week. And the intention is to have both a joint meeting with Select Board and Board of Health to have full discussion on this. I believe it's December 9th is what we have on schedule. So in the meantime, like Steve said, there was no intent to hide any information. It's information that we only just received. And even then, there's explanations for everything that just happened. So I would say please have patience while we get the information all together and we get our final report from CDM Smith about how PFAS is looking at the landfill. And we will have that discussion in depth now that we have the full report, the conclusive reports on December 9th. The memo will also be is in the packet as well.
So we're gonna we'll wait to talk about this on the 9th with that joint meeting.
I would suggest so, because right now we're working with information with not all of the information and honestly some inaccurate information. So I would suggest that we wait for December 9th.
Can I ask a question?
It's on.
Go ahead, Meredith.
I'm just curious why it is taking so long for this information to come out. As someone who I live near the airport, it feels like the report came out in April. Nobody knew till July. They didn't start testing people's water who lived west of the airport until late July. It sort of feels a little bit like maybe we're not being super transparent. Like everyone was kind of sitting at home in March and April, and maybe that this could have been released sooner. I just feel that maybe we need to be a little more transparent because this is big, scary stuff and is something that I personally am very, very concerned about.
Understandable. We definitely get that. As far as sitting at home, I know I haven't been sitting at home in March, April, June, May, July, August, October, September. We've been neck deep in COVID. So what we're trying to do is get the information out as soon as we receive it. So like this information that we received in that email, literally received it last week. So we were getting it out as soon as possible. And some of it is inconclusive. And then also we're coordinating between two completely separate entities. It's really easy to say that the town and the airport are the same, but the airport is actually governed by a different board as well. They have their own council, they have their own licensed site professionals. And then also we have our own council, our own licensed site professionals, and we're one of many boards with the town. So it's not that we're trying to be in, we're trying to be as transparent as possible. Everyone is. It's just that it takes a very long time. Government takes a long time.
Malcolm?
Yeah, I think there's some angst about this, but I think the information received, yes, it's preliminary. Yes, there's some, the methodology might not have been correct and standard, but I think it's important we remind ourselves that this is still an issue here.
Yes.
Excuse me. Apologize for that. I think it's important that it's brought up so we don't forget about it, and we make sure that the Board of Health is involved and knows what's going on. So I know some people have been critical of the way it's handled. Maybe it could have been better, but I think the point is it's an issue and we have to know about it, and we have to continue to make sure the public knows about it.
Jim?
Roberto, I just want to know, will we in fact have all the information that we need for our next meeting? I remember trying to get some stuff from the landfill. Every time we settled that information for a meeting that we never got it. They didn't get it. For months and months and months. I just want to know that for our next meeting, we will in fact have all the information that we need to proceed.
Yes, we're actually dealing with a different entity here. What we were dealing with the landfill last time was actually SMAS, and they were sitting on the report for a long time. This is actually a completely different entity, and they expect the report to be done within the next few days. But we do expect, the answer is yes, we do expect you to have all the information you need before the next meeting.
Thank you.
Any other questions?
Are we going to want to take some public comment on this? There's a hand up.
Is there a hand? Sure.
Bill, you're up.
Okay, thank you very much. I'm glad that last meeting I asked that you put this on the agenda, and thank you for doing so. The thing I wanted to note that I didn't get a chance to mention last week was, the tip of the iceberg was the discovery at the airport. And then the town formed, set up a committee headed by Chuck Larson to check other areas in the town. But before that committee even got going, the water department took it upon themselves to test for PFAS on their properties. Even though the Mass DEP does not require PFAS to be sampled at the water supplies. Yet the water department went ahead and started that on their own. Given all the information that's out about leachate contamination with PFAS, those of us that live at the West End have for years been very concerned about the landfill and the runoff and the leachate from there, compounded by the fact that it's also the host of cake that comes from the waste treatment plant. And coupled with the information that waste treatment plants across the country are starting to have to deal with PFAS treatments within their facilities. It's really, as we've talked about on many other occasions, we're an island. So it's not like we can effectively deal with this by shipping it someplace. We have to deal with it here. So the bottom line is, even though the DEP currently doesn't have regulations requiring the landfill to be tested, and even though there aren't standards for that, there are guidelines. And I would think that it's in our best interest that we begin testing the landfill leachate now, while we're waiting for those guidelines and information to be sent. And it's taken the town a long time to ramp up to deal with the drainage issues at the landfill that have been known for years. And the fact that that's all happened really raises concern about what's been going into the ponds, ditch, and ultimately the creek in the harbor. So I would strenuously hope that sooner than later, the town takes it upon itself to start gathering information so it's ready when we get some direction here.
Thanks, Bill. I think maybe Libby can enlighten us a little bit on how fast that's moving. I think it's moving now. Correct?
Sure, yes, it is underway. We are going to be doing testing ahead of DEP requirements. We've been in pretty close contact with DEP about it. This is the report that Roberto was mentioning that we're hoping to have out last week. It's an initial island-wide risk assessment. And there are a lot of things that need to be taken into consideration, and a lot of, this is complicated. This isn't simple and, do a test, put out a report, and that's that. This is much more complicated than that. And we're ahead of what a lot of other towns are doing. I'm glad Bill mentioned that this is an issue, a growing issue with sewer treatment plants and a lot of other industries. And as soon as we learned about the airport's issue, the town initiated on its own, without being required to, the island-wide risk assessment. So we've had at least one update publicly at the select board meeting where we're mentioning this joint meeting with the Board of Health and the select board on December 9th. The airport has a public forum tomorrow at 5 o'clock. And I don't know how much more transparent either of us could have been. But we do need to get the information, and we need to get it into an understandable format for people. And I know there is a lot of concern about it. These are things that have been around for a while, and they're not going to go away tomorrow, even if we find it wherever. We're going to need to figure out how to get rid of it. And that isn't going to take a couple weeks. It's going to take some time and a lot of money. But anyway, that's the kind of update. We just don't know a lot right now. We're trying to find it out.
Melissa?
I just wanted to add that from the select board perspective, that I really do agree with Libby's statement that one, there's a dedicated task force that's working on this and looking at this and prioritizing it, working in conjunction with the airport. And I think that when there's more information to be shared, that we will get that information. It is a top priority, and not only is it a top priority from sort of an action and policy making standpoint, but in every single capital conversation we have, the resolution of PFAS is coming up, because I think that everyone knows that the remediation and or mitigation efforts are going to be very expensive, whatever they are. So I just wanted to chime in that from that perspective, this is at the forefront of the select board's minds.
Meredith?
I'm just curious. I know that the Vineyard is having this problem. Barnstable is having this problem. I mean, we're not the first people. So are we finding out what maybe since this is sort of just coming out here, what they've already done? I know that they're already involved in some stuff, because I do think it's nice. Like, yes, this is going to be a big, enormous, huge issue. And I'm sure money wise, but I also think like this is affecting people. They can't drink their water in their house. They can't shower in their house. They can't bathe their children in their house. Like, this is a huge issue. So I feel like I was very upset that the report that came out in April did not get released until July. And I know I was just getting on the Board of Health then, but I thought that was like a little bit late. So I just don't know if we're collaborating with any other towns that are involved, that are also having this issue.
Libby?
First of all, the air report that you're speaking about is, I believe, an airport report, and I can't speak for them about the issuance of that report. The Barnstable situation, when that came to our attention months ago, Roberto and I and Mark Willett and some other people in the town were on a phone call. We arranged a phone call with Barnstable County and some other Barnstable town officials, and their situation's a bit different. Their public water supply was contaminated. Our public water supply is not contaminated. So they have a different issue to deal with, but they did have some good information about what they did. We will most likely have an issue with contamination of soil and the issue of people's wells. So that's being addressed as quickly as it can be in the identified area around the airport, with extending the public water supply there. That may be something we can do elsewhere once we've identified the risk areas. But yes, in answer to the question, are we talking with other towns who are having similar issues? Yes, but when you talk to them, sometimes it's not exactly the same issue. So not everybody's dealing with it the same way, because it's not quite the same thing.
Thank you.
Any other questions on this, or are we good? And we'll,
I think Bill Greeter is still on. You raised your hand again.
go ahead, Bill.
Am I on? Did I successfully? Oh, here we go.
Yes.
Not to belabor the point, besides testing the landfill, it sounds, that's the track that will be coming sooner than later. It's not just the landfill that we'd be concerned about. It's the tributaries around the landfill. One of the things in the nitration studies and reduction process, it's been noted and actually touted by the landfill that a lot of their measures for redirecting runoff and leachate collection has reduced the amount of nitrogen found in the adjacent pond area. So it's already been established through that process that the runoff and stuff has in fact been going in there. So I would think that part of this process of checking the landfill absolutely is going to need to include the waterways around it, since that's part of the study for nitrogen. So I just wanted to toss that out there. The other thing is, we all know that the contract with the landfill is coming to the end, and the town through George Aronson has started a review process on that. And one would think that part of the discussion on the future of the landfill might very well need to include the need to have a different type of process that is efficient and robust enough to deal with PFAS destroying it, as opposed to collecting it in giant modules of granular material that we then have to deal with as a hazmat. So it's not just going to be affecting a particular budget. It's going to be several budgets across the board. So thank you for taking the time.
Thanks, Bill. Libby?
Just want to mention, that's why it's an island-wide risk assessment. It's not just the landfill. It's all the areas that Bill was referring to. And we haven't even identified how PFAS would be removed or processed or whatever. That is yet to be figured out.
Thanks. Anybody else? Okay. There's no other hands up, right?
Bill, your hand's still up. Do you want me to lower that? Nope. Aisha, there's a hand up, Aisha. So let me disconnect Bill here. Sorry. Aisha, you're up.
Hi, can you hear me?
Yes, we can.
Hi, thank you for taking my call. I just had a question about the meeting. So on December 9th, that would be the meeting to go over the results of the landfill and the leachate and the sludge. Are all three of those being tested, or what or will there be any additional testing at that time?
That report will be an initial report,
Okay.
which will review what we've determined so far or discovered so far that are potential sources of PFAS around the island not related to the airport. So I don't know if exact results will be fully and totally analyzed by then, but or all of those other things that you mentioned. I think that is the hope. I did not think that this item on your agenda was going to go this deep. So otherwise I would have had other people on who are actually the project managers of this, which is not me exactly. So I'm speaking from a very, higher level of overview, not deep down. So those types of things would be handled by the project managers, which I expect they will discuss at the December 9th meeting. Yes.
Okay, and then so until that point, will the compost still continue to be made, or is there going to be a pause on it until we do further testing or investigations?
My understanding is that the compost is continuing to be produced, but it is not available for the public.
Okay. Okay. Thank you.
Thank you.
Thank you.
Okay. Let's, next item on the agenda, review of the minutes from October 22nd, 2020.
Stephen, sorry, can I ask a quick question
Sure.
related to PFAS? On 12/9, is this report coming to the select board, and that's where it will be reviewed, or is this a separate Board of Health meeting or separate PFAS meeting?
Believe we're posting it as a joint meeting of select board and
A joint meeting, but that night, Wednesday night, at the regularly scheduled 5 o'clock meeting. Okay. The Board of Health's next regularly scheduled meeting is scheduled for when? Is that December 10th or is that the 17th?
through the 17th.
Okay. I'm asking because I'm wondering if it may be prudent to have a Board of Health meeting between the 9th and the 17th. But I'm going to keep thinking about that. Already there have been some questions raised regarding the PFAS report and our role in that. And also I think Meredith's point and through public comment, some further conversation around COVID. I'm not sure I'm comfortable waiting until the 17th to have those conversations again. So I'm curious if everybody else would be comfortable moving that meeting up to the 10th.
We could probably have a dedicated meeting on the 10th, but we have to check to see what availability we have on the calendar.
Okay, it's a thought for maybe you and Steve and Malcolm can review that.
Mr. Chairman, just one quick thing. I'm trying to communicate with staff while I'm sitting here about this whole PFAS issue, which I didn't realize was going to get this involved. But we're kind of thinking that this might even necessitate a separate meeting, not on a select board Wednesday night, because it could take a while in gathering. So we will have to get back to you about that. So tentatively right now, it's on the board's December 9th agenda, but that may be something we have to talk to you and the select board chair about with respect to a different meeting.
I think it needs to be its own.
Go ahead.
I'm just going to say that right now because, coming into the holidays, we're going to have 2 canceled meetings at the end of December, and still our ongoing discussions about COVID and managing that takes up a very long portion of our meetings. And I don't see that not continuing. So
I agree, Don. That's
Sorry
kind
to just jump in.
Yeah, no, that's where I was going with my comment earlier, is that I'm concerned about these two items being sandwiched in with other regular business.
Yeah, let's go ahead and move on and then we'll just set up a separate meeting for this
Yeah,
as we go along. Because there's still the whole rest of the agenda to go to.
right.
And I believe Concom still has it at 5.
Review of the minutes, October 22nd, 2020, and November 12th, 2020. Can I get a motion? Any corrections or comments? Can I get a motion to approve the minutes?
So moved.
Can I get a second?
Second.
Okay, by roll call vote, Jim Cooper,
Yes.
Meredith Lepre,
Yes.
Malcolm McNabb,
Yes, on the meeting I was present, abstained on the meeting I was not present.
Melissa Murphy,
Yes.
and Bisco says yes. Next on the agenda, loan request, Fuller, 4 Kelly Road, septic to sewer.
Just a loan request to connect to the sewer now that they're part of the SHIMO project. No objections.
Okay, can I get a motion to approve the loan request at 4 Kelly Road?
So moved.
Can I get a second?
Second,
Okay, all in favor, Jim Cooper,
Yes.
Meredith Lepre,
Yes.
Malcolm McNabb,
yes,
Melissa Murphy,
Yes.
and Steve Visco says yes. Loan request approved. Okay, clarify IA to sewer time frame. So this, in September, the 17th, our meeting, it was a little unclear of the wording in the minutes. So we wanted to clarify the whole IA to sewer timeframe and what we approved as a policy to go moving forward from that date. So just to, quickly, a brief overview of the policy that was set in October of 2015. I'll just read this really quickly to give you an overview. The Board of Health developed a policy 10/2015 to address properties that install innovative alternative septic systems. The issue being sewer may come to the neighborhood, and local Board of Health Regulation 69, which is mandatory hookup, would require the property to connect to sewer within 2 years, if not in a harbor, watershed, wellhead protection zone. And if you are in a watershed, you'd have 6 months. The idea was not to penalize property owners twice. They put an expensive IA in, possibly took out a loan, and a few years later might be required to connect to the sewer if it would come to their neighborhood. Seeing that there's a possible financial burden for property owners in this situation, the board developed a policy stating that any property owner who installed an IA would get 10 years from the date of the certificate of compliance for said IA septic system to use that system before they would be required to connect to a municipal sewer if it was to become available in those 10 years. So quickly, we need to just get a motion to substantiate what we approved on 9/17/20. So, and I would like to get a motion from somebody on the lines of the saying of the amendment to the policy would be on 9/17/2020, the board amended this policy to 15 years for any property owner that installed an IA and became subject to local Board of Health Regulation 69, which is mandatory connection to the sewer. Part of this amendment to this policy gave all IA septic systems that already installed 15 years from 9/17/2020, should they become subject to local Board of Health Regulation 69. Any IA septic system installed after 9/17/2020 will get 15 years from the date of their certificate of compliance, should they become subject to a local Board of Health Regulation 69 mandatory connection to sewer. Could I have a motion as to those words, which will be part of the policy?
Stephen, what's the problem?
The problem is in our meeting last time, it wasn't really spelled out, and it was hard to interpret through the minutes what the policy was going to be. So I'm trying to straighten that out for everybody.
So I thought we gave everybody 15 years from that date, no matter when they put their system in. So if someone put their system in 8 years ago, okay, that 8 years didn't count because the way I understood it, everybody after that date in September was starting fresh with 15 years. Is that right?
Correct, but what I'm trying to do here is for the record, in that when we did that, it was unclear in the minutes of how it read. So what we're trying to do here is correct that wording to make sure it's clear.
Okay. So can council help us with that? Steve?
This is just a policy.
Okay.
Yeah, I would suggest just voting it in as a policy rather than
Policy.
Melissa.
I'm just curious if, Roberto, do you have the language? Could you screen share for a minute and we could look at it? It's a little hard for me to follow what's unclear.
I do. Give me just a minute. Steve, do you remember when we connected with that?
How it should read, or
Yeah, when there was a wording that we used, and I just don't remember when. That was just when we discussed that. You emailed it to me, and I just don't remember where it is.
no, it was an email from September 21st that Ian brought up.
September
I
20th.
sent that to you yesterday or today.
Yeah, that's the issue.
I don't mean to make it that complicated, Roberto. I'm sorry. I'm trying to follow along with what would make it clearer, and I'm having a hard time.
You see what you caused, Melissa?
I just sent it again.
All right, here we go. All right, here we go. So we can see it up. That's weird. Sorry again. Bear with me for just a moment. My apologies. Here we go.
Berto,
Yes, Terry.
I think if this is the motion as written that you approve, you're gonna have to email it to me.
Absolutely.
Yeah, and
So I can include it in the minutes as it is, rather than trying to rush and copy or paraphrase.
Of course. Of course.
the only thing that we would strike from that paragraph would be in parentheses at the bottom, yes, if within the 2-year permit period, it's just going to be start from the C of C. You don't need to get as technical as the 2-year permit period.
Does that work?
That works, yes.
All right, so I'm going to stop the share of the screen.
Did everybody see that, just to be?
Mhm.
Do you need a motion for that, Steve?
Yes.
Okay,
yes.
I'd like to make a motion to amend. My God, what were we just looking at?
The
Whatever we were looking at. I'd like to make a motion to amend that as edited.
Second,
Okay. All in favor by roll call. Jim Cooper,
Yes.
Meredith Lepre,
Yes.
Malcolm McNabb,
yes.
Melissa Murphy. She said yes. And
I
Steve
And I'm
is-
so sorry, you guys, I have to run. I have a 4:30 board meeting, so I have to leave, but thank you for today.
okay, thanks. And Steve Bisco says yes. Thank you. Okay, we get that straightened out.
All right.
Okay. Let's COVID-19 emergency orders.
Yes. So we've had a good meeting today with the Builders Association. We have some representatives on here today. Bob Little, I believe Frank Daly is here today, and I don't know who the third member is. So I'm going to go ahead and share the screen so that we can see what the changes were, and we can go from there. But the good news is we've had a discussion with. Let me see if I can see if we can show this better. All right, there we go. So there was a enforcement plan that was sent to the select board yesterday. This will be added to it as an appendix at the end because this is specifically to Order 14. That way, as we do new orders, new enforcement plans can be just thrown in like that as appendices. The Builders Association board and Steve and Don met today. We discussed the steps 1 through 5 in this case, but it's the most important parts are the education, fines, and the suspensions on how to deal with the emergency order 14, which is the landscaping construction. So what we agreed upon here is the NBA is willing to open up a COVID hotline. So if people have questions about, COVID practices, work sites that are doing best practices, questions about best practices, or even if they want to discuss violations that they're seeing on other job sites or even their own job sites, they can call the NBA in order to have some questions answered and peer reviewed. So it's less intimidating than the health department coming down as a hammer. So we believe that it's actually a really good, a good method, a good first step, so that not everything goes straight to enforcement. That way, we can, with that peer review and that peer discussion, we believe that we can probably get better adherence to the COVID regulations than by going just with the stick. The fines are the same as the other orders, but we put it in to keep it there. Level 3 enforcement would be a 1-day suspension for a repeat offender, and level 4 enforcement would be a 2-week suspension if we catch them at this point 3 times. So it's kind of a 3 strikes you're out situation. So if I missed anything, NBA, please step in. But otherwise, I'd love to hear what the board has to say. I can see everyone on the screen here because I have two computer screens, so I can, if you raise your hand, I can I can call on Malcolm.
Yeah, this is input from the NBA. What about landscapers?
So with the landscapers right now, we haven't had a chance to get a big group of them together because there's not a central group that represents 300 landscapers like the NBA does. So this is really good for the Builders Association, and I believe we can definitely discuss the same with the landscapers. We only had the opportunity to connect with the NBA today. It's really hard to get a large group of the landscapers together in one room at one time because there isn't a central association. Mary?
So does level 2 have like 4 levels? So they could get fined $50, then the next time $100, then $200, and $300?
So this with level 2, those 4 levels of fining, that's actually what's written in the Chapter 21D law. That's the tiers that are able to be done. However, when we did vote in Order 14, we did elect to go straight to the 300, which was also allowed through council.
I just wanted to make sure we weren't giving people like 4 chances and then they got a 1-day suspension, because I think if you don't know you should be wearing a mask now, then you probably live under a rock. And I was at the hospital the other day and had to call them because there were people working in the parking lot not wearing masks. And I kind of feel this is fine, but I sort of feel at this point like we're past education. We've had 100 cases in 30 days. We're past education.
Absolutely, and as we're catching it, we're going straight to the $300 fines, and that's what we've been doing. This COVID hotline is a way to also create more of a self-policing feedback loop as well. Any other questions? Okay, so I'm going to go ahead and stop sharing this so that we can go into discussions. All right. So I would love to see what your opinions on that was. If you believe that it's a good move, we can go ahead and endorse it with a vote, and we can move forward, starting that immediately. Yes, Jimmy.
I agree with her. I don't see why anybody should have more than one shot at this thing. Just like she said, if you don't know, oh, I'm sorry, someone.
Yeah, no, Jimmy, just what I was saying.
Oh, okay.
Yeah.
You know, I mean, if you don't know, you're supposed to have a mask. And the funny thing about this is most of the people have the mask around their neck. They just won't pull it up over their nose. So if you have to tell someone 4 times, I mean, there's no hope. You know what I'm saying? You give them one shot and then you just level them.
We have moved on already to that. We elected to go straight to the $300 fine, and that's their only shot.
And just to bring this, the little story I told you last time about the people in Sconset. When I left after the meeting, I went down and bought a Nantucket paper, read the Nantucket paper, and that person's name was in the paper for getting a $900 fine the week before. So, you know what I'm saying? Obviously, some of the people are not going to do it.
Yes, Jimmy, you're actually a member of the Board of Health, and you're allowed to enforce that already. So we can discuss this offline. Come over to the office. We can give you a ticket book if you would like, and but you are allowed to enforce it as a member of the Board of Health.
Okay, thank you.
It's Bob. You're muted, Bob.
Okay, so Jimmy, to address your concern, in our discussion this morning, I think the members of the Builders Association Board are pretty clear that our membership, which lists about 300 plus folks, are very compliant and are very invested in this community. And we are very knowledgeable about the code. We know how to follow the rules. We're part of the compliance club. It's the folks that simply don't read the book or that are commuting from other communities that are clueless about what we're dealing with here that are of real concern to us. And so part of the 228-1600 is an opportunity for eyes and ears. It's the old Bill Pittman's thing. If you see something, say something. And if you have a safe place to say something, the word will get through. Our voicemail system will translate a voicemail into an email. It will be emailed to all 12 of our members of the board of directors. And the theory is that at least one of us will know the offender or know about the offender and can give like a little friendly kick in the butt and say, yo, dude, get with it because you're screwing it up for the rest of us. And if they blow it off, then we turn it over to Roberto and he deals with it. So it's the nice guy approach at first from colleagues. And if people don't get it, well, then we got to get tough. And for the off-islanders, the earlier discussion about Ms. Lepre, your comments about folks coming off the boat, maybe we can conjure up some cooperative spirit to get the off-islanders to join with our mission here. But it's basically all of us in the industry that are compliant trying to work together to help minimize the damage of the situation. Thank you.
Thank you. Thank you.
So would it be possible to get a endorsement of this? If you agree, I don't want to.
Do we need a motion to the effects?
I would like it just to have it, and that way we can give like the board of directors for the NBA, they're here, so it would be nice for them to get that vote of confidence that we have that we're partnering at this point.
Sure. And earlier how I feel. That was a good meeting, and the NBA, the Build Association was very, very sincere, and I think this is just, it's almost like another tool, and I think it's going to help a lot myself.
Absolutely. I fully agree. I hope the Builders Association feels in the same way, that it was a very productive meeting. And I do believe that working together in this moving forward is actually going to be very helpful in this.
Just another comment. Jimmy, you said that you read in the paper after your little Wisconsin rant, you read in the paper about the same person that you were getting on had been published in the paper. And we talked a little bit about that this morning, and we don't really understand how we can do that. But people don't like to be published in the paper for misbehaving. And if the word gets around that one building company or another is just blowing off the rules, that can have a pretty huge negative impact on their reputation. So I don't know how we work that, is to maybe talk to Mary Ann and see about a little above the fold or a weekly posting. But for the folks that are playing by the rules, they should be able to continue doing what we're doing really, really well. It's the others that just don't get it.
No, I agree with you 100%. I agree with you 100%. It's the people that just, they'll never learn. It's that 10% of everything that happens. There's always 10% that will never learn. And I was just amazed after I talked to those guys. I'm reading the paper and I said, oh my God, his name is in the paper for last week. So we'll get through it.
Oh yeah. Thank you all.
Thank you.
Thanks, Bob.
Yep.
So can I get a motion as to, for this emergency order to accept the Builders Association's recommendations as a part in this order?
Yes, so moved.
Okay, got a second. Okay, all in favor by roll call. Malcolm McNabb.
Yes.
Jim Cooper.
Yes.
Meredith Lepre,
Yes.
and Steve Visco says yes.
Okay. And then as far as I remember, Malcolm, I know last week you mentioned about making it island-wide to do the contact tracing list. I haven't had a chance to write up that order and to have town council with that, but I am working on
That's fine.
Mm.
Are we going to discuss some of the recent data or?
it. I can definitely pull up the same information as before.
I'm just curious, as our percentage is what, 5.1?
It was 5.1 as of yesterday, and then including yesterday's numbers, though, we dropped back down to 4.9. So today we're still going to be, I keep wanting to say diagnosed, classified as red in the state numbers. But next week, if this trend keeps going down, and today's sewer report came through and it shows the trend going back down.
That's what because it was a point a week or two ago, I thought of be coming to this meeting and suggest that we close the island down again and go back to March. I mean, I'm glad we're going down, or at least stable. It's not great, but it's better than a motion from myself to go back to March rules.
No, correct. No, that's good. Let me go ahead and share my screen so that you can see the new report. It should be on your screen at this point. So we're showing it going down to half of where it was at the peak of last week. So let me scroll down to where it shows so we're now back to the 1 to 5 cases, which is still not where we want to be.
No.
But it is definitely way better than what it was saying was more than 10 per day as of the last report. So this is great news.
I find it interesting because when we first started using this, I was quite skeptical of it. I tried to get into their methodology and I couldn't get into it. It was sort of private, but it actually has been quite predictive.
It really has been. It took a little bit let me stop the sharing here. It took a little bit. The first few tests were definitely a little rocky. They were off by a certain percentage, but as they've been dialing it in, using more and more data from other towns and cities in Massachusetts, they've really dialed it in.
Right.
And it's
so good. I'll stop talking. So we're down below 5. I know our metric is really 10 when we really start putting the brakes on things. But if I start seeing it 6, 7, I think we're going to have to act before 10.
Yeah.
I think that's the message the island should know. And all his comments about, I like Meredith's, if you don't know to wear a mask, I don't know where you've been living.
Right.
That sounds good. And then this will also be in the packet as well. We'll go ahead and post it. And I think David already posted it on the town website for review. So, and I think we're good.
Okay. Board member updates and concerns. Anything from anybody? Seeing none. Is everybody all set? I guess we'll I get a motion to adjourn then.
So moved.
Second.
Second.
All in favor by roll call. Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
Jim Cooper,
Yes.
and Steve Visco says yes.
All right. And thank you
Thanks,
to the
everybody,
NVA for being here. I really
Thanks
appreciate it.
everybody for coming in, and the rest of the board members from the Builders Association.
Thank you all very much.
Happy Thanksgiving, everyone.
Thanks, Terry.
Happy Thanksgiving.
Thank you.